If you want to get into medical or dentistry school in the UK, you're going to have to attend at least one interview. That's a fact. But what kind of interview will this be? Some universities use traditional panel interviews, back and forth conversations between you and one or more interviewers, but many medical schools in the UK actually use a completely different format. Today, we're talking about multiple mini interviews, or MMIs. This introduction to the unique interview format will cover what they are, which universities use them, and what you can expect during a standard session. Let's get started. So, multiple mini interviews, or MMIs for short. As the name suggests, these aren't single interviews that run continuously between the same set of interviewers. Instead, you'll need to complete multiple short interviews, each of which lasts roughly 5 to 10 minutes. Each interview is referred to as a station, and you'll usually have to complete between 6 and 10 of these during a session. This will involve literally standing up and walking to each new station once the time is up, a bit like speed dating. Each station is hosted by a different admissions tutor, and each one features a unique task or question, which we'll explore further later in the video. These interviews are traditionally held in person, though universities had to pivot to remote versions in 2020. Most have reverted back to MMIs being held on campus, but some may still offer remote ones instead. This is a fairly complicated interviewing method that takes a lot of time and planning to organise, as well as requiring far more faculty members to run. So why do so many medical schools run these instead of simpler panel interviews? From a practical point of view, they allow medical schools to interview multiple applicants at the same time, which is extremely useful for universities that receive a lot of applications. Although some universities are highly selective of who they invite to interviews, others prefer to have a wide range of applicants, so MMIs are a more efficient way to get through them. Beyond this though, many consider MMIs to actually be a more effective way of interviewing applicants. Firstly, utilising a wide spread of admissions tutors eliminates the potential bias of any individual tutor, allowing for a fairer assessment. Secondly, this interview format allows applicants to experience a wider variety of questions and tasks, meaning more skills are tested, including some that would be more difficult to assess in a standard panel interview. MMIs are actually used by the vast majority of medical schools in the UK, with at least 35 universities in the UK choosing them over standard interviews. Some of the biggest names in this list include UCL, Imperial College London, and St Andrews, some of the highest rated medical schools in the UK. Oxford and Cambridge don't use MMIs, as these universities both use panel interviews for every course that they teach. Some other universities that don't use them include Glasgow, Southampton, and Queen Mary's. When should you expect to be attending your MMIs? That depends on the university, but most sessions will run between December and March each year. You can check out the guide linked in the description to find more details about your chosen medical schools. Naturally, you won't get any results or feedback from your MMI on the day. Instead, you'll have to wait until each medical school releases their offers to find out how you did. In some cases, you may need to specifically request feedback if they don't provide it automatically. So, with all the practical details out of the way, let's next take a look at the types of stations you can expect to see in a typical MMI. These are all general concepts that could encompass a wide variety of questions and tasks, but it's important to understand the themes and question styles that may appear. Starting off simple, you may just be asked a traditional interview question. This could be something simple like, why medicine, or why this university? Or it could be a question that covers subject knowledge, such as being asked to describe a certain internal system of the body. These are as close to standard panel interview questions as you can get in an MMI, so the challenge comes from just delivering a good response. Another station type that is similar to this is ethical scenario stations. Here, you'll be given a difficult ethical situation to respond to. You must show consideration towards the patient and everyone involved, whilst also adhering to proper medical conduct and the 4 pillars of medical ethics, to ultimately reach the most ethical and moral compromise possible in a difficult but very plausible real-life scenario. For example, you may be given a list of 20 people, including some brief medical histories, and select 5 to save in a disaster. Of course, you'll be given time to read the information and think things through, though it's a good idea to think out loud rather than sit in silence while you try to find the best answer. There's rarely an objectively correct answer to these questions, so what they're really assessing is your thought process within a difficult situation. The one common MMI station that everyone dreads is the roleplay station. These are so common because, in medicine, your ability to speak with patients is equally as important as your academic knowledge. The scenarios given could be highly related to medicine, such as telling an actor that they have a serious illness, or it could be something more general. The overarching theme with these scenarios is usually having to deliver bad news to someone, though you may also have other scenarios such as dealing with a colleague's misconduct. Next, we have data analysis stations. This style of station is mostly based on unseen material that you will have to look at a few minutes before the actual question is asked. This tests your ability to take in new information and analyse it in a meaningful and intelligent way. For example, you may be given a graph showing rates of disease for a certain time and place, and then asked to comment on it in a constructive and thoughtful manner. Problem-based learning stations will likely be used at universities that utilise PBL teaching, and they involve working with another candidate, or an actor, to complete a task. You could be given a task as a group that needs to be solved using teamwork and strong, clear communication skills. As an example, you're placed in a small group of other applicants and are asked to try and solve a logical or ethical puzzle, like having to come to a group consensus on what to do in an ethical scenario. Lastly, we have explanation and communication scenarios. These are both integral skills for any future doctor or dentist, hence why they're tested. As an example, you're asked to describe a practical task to an actor without using your hands, such as how to use chopsticks. The actor will assume zero prior knowledge and take your suggestions entirely, meaning clear explanation is essential. You may also need to work with another applicant in these stations, such as being put into a pair and being asked to draw a picture through your partner's instruction, without having seen the picture before. This isn't a comprehensive list of all the station types you may see, but these are some of the most common types to expect and prepare for. You can, and should, check the details about the specific MMI structure and stations used at each medical school, including past applicant experiences and any details published on the official university website. These are crucial to research before you start preparing for your MMI. But before we wrap up, let's consider how we should go about preparing. While there are lots of specific tips for approaching each individual MMI station, we'll cover those in another video. Instead, here are some general things to consider. The most effective way to prepare for MMIs is by going through as many different scenarios as possible. The aim of MMI preparation is to have an understanding of all the different question styles, even if not all of them will necessarily appear in your MMI. You'll need to ask for help from peers or family for the roleplay and PBL stations, although attending a mock MMI is also a great way to both prepare and learn new techniques, as well as gain expert feedback for your performance in each station. If other students at your school are attending MMIs, it's a great idea to share resources and get together regularly to practice and provide feedback to each other. On the day, it's important to stay calm, give yourself time to think, and don't worry about perfecting your answers. As long as you can demonstrate an understanding of the key areas and the ability to think logically during difficult situations, you'll be able to leave a good impression on your interviewers. So, you should now have a clearer understanding of what multiple mini-interviews are and what to expect from them. But this is just the beginning of your preparation. Be sure to visit uniadmissions.co.uk to learn even more about both MMIs and panel interviews for medicine and dentistry. And subscribe for even more videos about UK medical schools, including Oxford and Cambridge. Best of luck with your preparation and see you again soon. Thanks for watching.